What would you say is something that you're really proud of accomplishing?
Lots of things on the professional side. The one that stands out for me is the work I did in home care with our providers on kind of that whole change in the conversation, because that to me was about understanding the experience of home care through the eyes of patients and their families. And I think it was pretty much a game changer for us in Toronto, and it spread to other parts of the province and even across Canada. I heard people talking about changing the conversation and this idea starting with what's most important to you.
It makes all the difference when you know your work is making an impact out there.
It totally does.
And can you share a failure or a mistake or a low point in your life or your leadership journey that has had a significant impact for you?
The one that comes to mind is working in home care almost 20 years ago. It was a pretty tough time in healthcare under that government at the time, lots of cuts. And we had to make a lot of cuts and reductions in services. It was just an awful time. And we were cutting hours from people, particularly personal support hours, in order to meet our budget. And I remember getting a call from a lady who was in her late 80s, who was one of our patients. And it really stuck with me because she said to me, look, going from 5 hours of support a week to 3 might not sound like a lot, but I'm 88 and I live alone. And I've come to rely on this service. The people who come into my home are like family. And I just urge you to think of another way. Mm-hmm. And it was really a pivotal moment because this was long before, you kind of thought about co-design and involving patients and caregivers in decisions. But at that point, it kind of made me think, if we had been talking to patients and families about the issue, and saying, here's where we're at, and involving them in the decision making, I think we would have been at a different place. So that was a very early lesson for me about that kind of mantra of never about me without me. And so, that's one that's really stayed with me. And we actually did change our budget planning after that, to think differently about the impact we were having and doing some more advocacy with the government because it was having such deep impact on people.
Yeah, I was just thinking about that the other day because in healthcare, it's only recently that we've started involving patients and families, but in all the other sectors like technology or banking or products, the customer has always been involved.
Absolutely. No, it's kind of inconceivable when you think about it that it's taken this long.
But we're there finally, so
we're there finally, and now I can't imagine doing it another way.
Right. And Anne, I know you said the OHT work is so great, and you have some really good partners. What would you say is the toughest challenge you are facing right now as a leader?
I think we've come a long way in starting to build. I mean, the relationships in East Toronto go back a long way, and they're quite deep. But I don't think yet we've had to make really tough decisions as a partnership. And as you think about, the future and where we need to go, things like making decisions about resource allocation, moving staff, maybe changing programs, people's turf in terms of the kinds of programs and services they've always delivered, and maybe that now needs to change. There's going to be some tension in the next while because to create an integrated system of care means that you change what you do, you change how you work, you change who you work with. It's a lot of change. So that to me, I think is going to be the challenges that we face in the next while, particularly as we face things like competition for scarce human resources. We're really going to have to do some thinking about, how we do things, who does what, how we move things around. And those are not going to be easy decisions, for sure.
How do you build the right team around you, especially when you are working as a consultant in your role?
Yeah, it's funny. I don't think of myself as a consultant. I know that kind of, I'm hired to help, but at the same time, I'm all in for like East Toronto and any of the other roles that I've been supporting across the province. So for me, I think one of the things that we've been able to do with East Toronto is build a support team of kind of in-kind support from our partners. We have received some implementation funding from the ministry, which has been very helpful. So we've been also able to support some part-time project roles. So for example, I think I last count 8 of our partner organizations are contributing some kind of project staffing towards East Toronto OHT projects, which is amazing. So I've been able to kind of leverage the strengths of our partner organizations to contribute resources. So for example, Wood Green Community Services, which is, a really large community services partner that works in lots of different neighborhoods and communities in East Toronto. We needed some help on figuring out our patient and community engagement strategy for OHT. So I chatted with them and they hired somebody who is a community engagement expert, and she works part-time now for Wood Green, and then part of her work is dedicated to the East Toronto work. And that's happened with multiple organizations where we've kind of leveraged their expertise and their staff to support. So we've created what I call a virtual project management office, which is made up of kind of staffing contributions from all kinds of different partners, and we work together. We meet monthly. They're all leading different aspects of our East Toronto work, providing project support and admin support. But we work as a team, and we meet monthly. We make sure that everybody's on track, that they understand how all the pieces fit together. They have the systems view of what's going on in East Toronto, even though they might be focused on their individual project. And so I've been able to, I didn't hire any of these folks, but the partners kind of saw it and responded to what they knew to be the gaps and where we needed support. And we've been able to pull those resources together to create, I think, an absolutely amazing team.
That's awesome. It's like further minimizing the barriers and putting everyone together. Our healthcare system is going through a huge transformation now. People are losing jobs, changing positions, competing for the same jobs. Organizations are competing for contracts. How do we all work together to, still achieve the same sort of vision that we have in mind?
I often think about, a year ago, we might have thought we had challenges. It was nothing like what we faced with COVID.
Yeah.
And yet it's pulled us together. And we've been able to rely on each other because we had a strong partnership, and that's been really important. As I think about the challenges that lay ahead, there's quite a few. And also because of COVID, Health Human Resources that you mentioned. I saw postings that Public Health, for example, is hiring up to 800 people. We're all competing now for staff for vaccination sites. We've lost a lot of personal support workers out of the system, and that's going to be hard to recruit people back into those jobs, whether it's home care or long-term care. We all pay different rates. That's one of the challenges that we're talking about. Personal support worker in home care, hospital, long-term care, similar job, but all paid differently. And in East Toronto, we've been looking at the impact on family physicians. We've had a number of family physicians who've indicated they're retiring or closing their clinics through COVID, and then they're just creating some gaps in primary care. So they're big challenges we're going to have to face. So I think that idea of coming together to create a health human resource strategy within an OHT is something that we're going to have to face and have just only dipped our toe in, but that's definitely going to be one of the big challenges